Okay, hello, good morning, everyone. It's Renee Liao here, Lifestyle Director 4 with Opulence Global, and very excited today to be able to hear from a very special gentleman that I just know you're all going to have just the ball of a time hearing from, and perhaps even learning from, with his vast background, of course, that he carries with him. So, before we get started, as usual, I want to say a very good morning, good afternoon, good evening to everyone on the call. As usual, please do help us put in your name and where you're tuning in from. We'd love to welcome you. And hello, yes, good morning, Mavis, and good morning, Maria from the Toronto market. Welcome. I hope you had a great event yesterday, Maria. I saw some videos at the church with your team, so great job there. Sorry I couldn't make it. A bit under the weather still. And go and welcome John Wilson from New York. Welcome to the call. Welcome. I also see that we have Francis Lee here. Yes, welcome to the call, Francis. Welcome, Shariza. How are you? And welcome, Chanel. Welcome. And Susan Thomas. And Werner, all the way from Thailand. I think you're still traveling. I see all your Facebook posts, but wherever you are, again, welcome to the call and thank you for tuning in. So here I just found our guest speaker today, and welcome, of course, Chris and Tammy. Let me just promote our guest speaker to the call. Alrighty, so who else do we have? Yes, okay, folks, it's not too late to invite, of course, and to send reminders to your team, to your friends, family, to your partners, your guests to join this call, as I can promise you it's going to become a very powerful call, and one that's going to send some wows to you, I believe. So not too late, again, to send those reminders out to your teams. And again, in the meantime, I want to also welcome Joy from Thailand. Welcome to the call. I also welcome Lucy. Thank you for joining the call this morning, Lucy. Welcome. Okay, so feel free to put into the chat box your name again and where you're tuning in from. We'd love to welcome you. And again, I can see that we have Mr. Alan Ogden on the call with us this morning. So again, welcome, Alan. It's going to do some more introductions and get started pretty soon. So again, we're going to have a very special guest speaker. Oh, hi, Alan.
Hi. Good morning.
Good morning. Good to have your microphone working. All good. How's your morning so far, Alan?
Well, for me, it's pretty early. So it's I got up at 6:30.
7 a.m. for you, right?
Yeah, that's right. It's all good.
Well, again, thank you for getting up so early to be on this call. I know it's not easy. Sometimes we have some night owls on the call, and it's not always easy getting up so early in the morning. So thank you. All right, well, welcome Verlin Mohammed, tuning in from the beautiful Caribbean island Anguilla. Welcome Verlin to the call. And hello, Ao Padaporn. Welcome to the call. Hello. Welcome to the call as well too from Thailand. That's fantastic. And welcome Amelia Sammy to the call as well too. Again, great to see you on the call yesterday. I did recall you asking a few questions. Again, great to see you so consistent being on all the calls. That's exactly what you want to do to start off on a perfect foot there. So again, thank you for being on the call today as well too. And yeah, so again, welcome Ronan. I believe you're somewhere in perhaps Israel still. Not ever sure where Ronan is. He's like a world traveler, a world trotter. Again, welcome Ronan to the call. And yes, hello, Lucy from Kenya. Welcome to the call. Thank you for being here today. So I'm sure, of course, that the call is going to just fill in as we go past the hour. And again, if it's not too late, please, again, do go and send reminders to all of your teams to be on this call, as I'm sure we're in for a very special treat today. And I'm actually really excited to be able to sort of put Mr. Alan Ogden here on the spotlight, just because of his immense background that you're going to hear about. And I'm really excited to share more of his story, of course, with all of you today and have him elaborate on that, of course, too. So, so good morning, Raymond from the Philippines. Yes, I'm just excited as you are to have this call with Alan as well, too. Hello, good morning, John and Sherry Buswood from Vancouver. It must be very early as well, 7 a.m. for you as well, too. So, oh, excuse me. Oh, and good morning, Mona. Yes, from Ottawa. Again, thank you for your warm welcome. And again, just can't wait to get this call started. Who else do we have here? Yes, Nataman. Good morning, Nataman from Thailand. Fantastic. We also have Carolyn from Ottawa. Good morning, Carolyn. And thanks for all that consistency in you recently. I see so many people here that's on the call yesterday. Again, also on the call today as well. I'm just going to take a quick pause here and just cough there. So I have a bit of a lingering cough. Again, it's I gotta tell you, FOL, it's just amazing. Every time my cough starts to get out of control, I put a few drops of FOL, and next thing you know, my coughing can stop for a good period of time. So the power of Fountain of Life, and again, I think that's one of the main things here that brought our special guest speaker today, Mr. Alan Ogden, to this company was perhaps a bit of it to do with, of course, our incredible products such as the Fountain of Life. So, without further ado, let's get this party started. And again, it gives me such great honor and privilege to sort of introduce you to our main feature on today's Leadership Cocktail Show. He is Mr. Alan Ogden, a lifestyle director too with Opulence Global. But more importantly, let me share a little bit about his background. So he is now a retired pharmacist, and I believe, if I heard correctly, when I first met Alan, he had almost 3 to 4 pharmacies running at the same time. I believe he even had a Shoppers Drug Mart at one point in time. So he is a retired pharmacist now and a natural health specialist. Alan Ogden served on the Science Advisory Board for several MLM companies. So if you look at someone like David Okamoto in our company, Mr. Alan Ogden served the same kind of role for other MLM companies. And in his previous company, he was actually the head of that Science Advisory Board, including the largest branded supplement company in the world. So Alan first got involved with the network marketing business when he felt that independent drugstores were going to be impacted by big box pharmacy chains. Having been an entrepreneur and his experiences from owning 2 successful pharmacy franchises in the past, Alan went on to build large multi-million-dollar network marketing organizations. With his long history in the medical, nutritional, and science fields, Alan educates and shares about prevention and treatment modalities using natural health products in addition to any medical practice. He understands the science behind Fountain of Life and is very excited to add this powerful natural product to his portfolio. Alan is also part of the Phyto Clinical expert panel. And again, just to share a little bit more, aside from his sort of introduction on his flyer, is that I only got a chance to meet Mr. Alan Ogden again through Mr. Anil Van Treater. And again, I believe the whole story was because he came across Fountain of Life. So let's just check on that story here and see the full story. But again, good morning, Alan. Thank you for being with us here today.
Good morning. Good morning. Wow. I guess you have to turn on my video, right?
Oh, that would be. Let me actually make you a co-host so you can now enable your own video. That would be helpful to see your handsome face. Okay, you should be able to turn your video now.
There we go.
Ah, looking younger and younger.
Well, good morning to everyone, and it's great to see the team from Thailand as well. Very, very familiar names there, and also lots of familiar names that came up on the chat. So good morning to you. I apologize. My office is quite, they just painted it. It's quite yellow. So I'm not really fussy about the color, but I can't do much about it. So excuse the background. I'll have
No, you know what? We're just so excited to have you here today and just pick your brain a little bit. So just again, starting from your background. So, you basically ran 2 existing pharmacies in the past. Is that correct?
Yeah. Before we get started, can I just say one thing about?
Of course.
So my family heritage is Scotland and England. My grandparents on one side are Scottish, the other are English, And so I did want to pay tribute to the Queen. Yes, very much so. My grandparents actually came here before there was an Alberta and Saskatchewan. So it was still the Northwest Territories.
Wow.
So they lived through the formation of the 10 provinces and at the time 2 territories. My
Wow.
family's had a long history in Canada, and many people might not know the name Ogden, but Peter Skeen Ogden was born in Montreal, Quebec, and he became the head of the Northwest Company. Now, what's significant about the Northwest Company is where I live now in Vancouver, British Columbia. Peter Skeen Ogden was the explorer who came here. He named the Columbia River. He named most of the mountain ranges here. And at one time, this area of was called British Columbia, but it was originally called, just called Columbia, and it included Idaho, Montana, Washington, and down into Oregon. And
Wow.
then when the United States and Britain came to the agreement that the 49th parallel would be the border, that's how it became British Columbia. So when you come to the West, you'll find lots of areas that are named Ogden, schools named Ogden, streets named Ogden, and that's all because of Peter Skeen Ogden. And then one street in Vancouver, which is named after my brother, who was the first Vancouver City archivist. And so we
Wow.
have a long history here. So I wanted to pay homage to the sovereign, the Queen, and certainly the one that would say, God bless the King, which I've never seen it said that in my life with others. So I just wanted to
Yeah.
mention that as we get started here.
Well, thank you for that. Again, I think we all just learned something new. I didn't even realize that from before, being born in Canada, for that matter. And of course, I do feel I just came back actually from, of course, London, and so
Yeah.
I got a chance to visit Versailles and Windsor Castle, and so it doesn't feel too far from home for me either for some reason. So I was a bit yeah, distraught when I heard about the sad passing, of course, of Queen Elizabeth. So. But wow! So again, if you ever meet Ogden, make sure to get his autograph. So,
Thank you. So back to your question, if you ask the 5-year-old what they wanted to be, usually it's a pirate, a fireman, a doctor, a nurse, or something. I wanted to be a pharmacist. I couldn't spell pharmacist, but I wanted to be a pharmacist. And that's because I had got really sick when I was a little guy, about 5 years old. I was staying with my great auntie in the huge city of Calgary, which was about 225,000 people at the time. And we walked over to this little store. I didn't know what it was, but this man gave me, I was quite sick, and this man gave me something to drink. And within 20 minutes, I felt better. So apparently I announced to the universe and my great auntie that someday I was going to do that. I was going to help people get out of pain. And completely forgot about that. And I became a hockey referee. One of the reasons I became a hockey referee was I could skate really well, but I wasn't very big. So hockey, I got bruised a lot in hockey, but I could skate with my friends and others and get paid for it. So that's how I became a hockey referee. And then when I was later in my teens, about 16 years old, I did get a job in a drugstore, and it honestly felt like coming home. So I did get through university, which was quite a challenge because I have dyslexia. So that was interesting to go through a science program, having to memorize most of everything because writing it down, it would make sense after.
wow.
So I just want to give anybody that has children who are having learning challenges, or if they have challenges themselves, give them hope that with persistence and a lot of hard work, you can actually accomplish something like that. I was very fortunate. I got recruited by Shoppers Drug Mart from university. I owned 2 Shoppers Drug Mart franchise stores. And then at about age 30, I was able to purchase my own store. And I had a store in a little town. Then I got another store in a little town, and then I got another store, basically just a dispensary across the street from a hospital in the city of Red Deer in Alberta. So we had.
Oh, I've been there.
Oh, you've been
Yeah. Wow.
Yeah. So we had those stores. We had about 200 staff, and I worked about 100 to 120 hours a week running those businesses, which was tremendous. For me, it was tremendous because I was doing something I loved. For my family, though, it wasn't so tremendous. Let's just say that. And one year, I was the first drugstore in Canada to put in scanners. Now, most people don't even know that their stores used to exist without scanners. But I was the first drugstore in Canada to put scanners in my stores and to get rid of price tickets. So that was quite a transition. I was the first fully computerized drugstores in all senses of the word, from my pharmacy to the front store.
Wow.
And that was in 1989 is when we did that. So 1989, we started with technology, and I really began to appreciate the power of technology back then and the reach that you could have with technology. So that at the same time, though, Shoppers Drug Mart was looking for stores in the rural communities, and they were trying to buy out my competitor in one of my the main store. And so I actually ended up selling to Shoppers Drug Mart and moving on. Why I did that is I had been stricken with a virus at the time, and it was so horrific. I don't like to relive this part of my life, but it was so horrific. I was given 6 days to live. So I came to, so Rennie, when I look back, I came to the end of what the medical profession could offer. And so I had to look for other ways. And of course, what I found was that outside of the medical profession, there were many options available to people for healing. And so I got involved in a network marketing company that does have the largest branded supplements in the world. I was educated by them. I went through their university. I became a spokesperson and a speaker for that company. Over the period of time I was with them, I think I spoke about 2,500 times to audiences across the world. And it just deepened my desire to know more and more and more. So that's just a little brief history. And then, as you know, I was involved in a company. We made the connection with the owner of Opulence Global with Nils' help, because we had some ideas about how they could maybe help grow, Opulence Global could grow internationally. And that led to what we have today. But really how that started was I had a friend who's on this call who had gout. And I had no product in my assortment of things. And I had many options available to me at that time, but I had nothing that was specific for gout. And so one day I was talking to Neil, and he said, "Oh, well, I've got this product called FOL, and I think it works pretty good for gout." So I said, "Well, we're at the end of our tether here." So I got some FOL. We got it to my friend. And by golly, within 3 or 4 days, his gout was in remission.
Wow.
My son-in-law also has had gout since he's early 20s. And he was having a little episode. I got him a bottle and his gout went into remission. I had 3 other friends that had gout, and I got them bottles of FOL, and they're same story. Within 2 or 3 days, it was in remission. So I was like, whoa, I really have to pay attention to this, find out what's in it, why it's so effective for what it's doing. And that's really why we are where we are today. So anyway, that's a little
Wow.
summary.
I feel like we just put like 50 years of or less of just craziness into like 5 minutes. And I kind of want to expand upon that too, because I think a lot of people are just saying, wow, wow, wow. And one of the things I wanted to ask though was, so because you were in this previous company, and I hope you don't mind talking about this because I think it helps people to understand the realities of sort of what happened during COVID. But so you were also like on the science advisory board or the head of the science advisory board, right? So
Oh,
aside
was.
from doing all these talks, I guess you're also guiding companies on like which products to use. Can you expand upon what your role was for that as well?
Oh, I'd love to. So yes, so I was chosen the first science advisory board that I was on. They chose two Canadians, and I was one of those Canadians. And it was really because of my pharmacy background that I got chosen to be on that board. Uh, when I was on that board, what we would do is we would sit down and we would look at the latest and greatest things that nutritional science had to offer, and we would decide what supplements we wanted to put together. I had a hand in formulating a number of those supplements. We were the first company actually to bring rhodiola to Canada. We were the first company to start using algae, which is now one of the most powerful supplements available for certain ailments. And I actually remember the day I met the scientist who's from Israel, and he brought his little container of pure algae. So this was, when I say pure algae, this was genetically pure. In other words, we knew every gene that was in this algae. And so then we could replicate it in a way that we knew the purity would be 100% when we were to use this particular product. And that was one of my roles, was really to advise on quality and on control and on the aspect of ongoing quality of product. That was one of my roles. And then formulation was another role. So I left that company for many reasons. One is my term with the Science Advisory Board was kind of drawing to a close. They were looking at making some significant changes as to how they ran that board. And so it was time to move on. And the next company that I became involved in was a company that had brought collagen protein to the market. And back in my days as a pharmacist, we used collagen protein medically. I'm very excited that Opulence is actually going to have a collagen protein product. People will be simply amazed and surprised at how powerful that product is going to be, and the health benefits that they're going to experience from that product. So I got involved in that company. There was a couple of other gentlemen on the Science Advisory Board at the time, but what brought me really to chair that company was I developed a product for children with autism. And we did a clinical trial with that product. It was very, very successful. And that was one of the things that I really wanted to do, Renee, in my life was do something for children. If you look at many of the supplement products that are on the market today, you'll read on the label, number one, they're not for pregnant, don't use it in a pregnant lady. And the reason that warning is on there, that has nothing to do with the product or its ingredients. It's the fact that the FDA and Health Canada don't allow us to do any kind of clinical trials on ladies while they're expecting. There's just a great fear around that, as most people can understand. If you're a mother and you're just found out you're expecting a child and somebody came along and said, hey, do you want to use an experimental product on that? Of course, you'd say no, right? So the government doesn't allow us to do it. And of course, we would not ask people to do that unless it was something very, very distressing to the parents. And in natural products, we can't. In medicine, there are now some variabilities that allow us to do trials on pregnant women. But so I wanted to make a product specifically that a person of any age could take. I'm also a geriatric pharmacist, a pediatric pharmacist. So, there was specialties in there. I worked on oncology for 16 years as well. And what I would see was just, there was no basis for how we used products or nutritional products in children and in the elderly and in these people that were suffering so greatly with cancer. And so I really put my time and attention into that and was able to formulate a product effective for autistic children. I've had about 1,600 cancer patients that we've helped nutritionally, which has been just most gratifying. And so one of the other things that really attracted me to Fountain of Life was, this is a product that's safe for children, for pregnant ladies. Anybody can take this product. There is nothing in this product that is in any way going to harm a vulnerable person. And it's also very safe for the elderly. And so that's really one of the reasons why I really want to pay attention. I want to get involved with this company and get a message out to people. And I'm not saying that David Okamoto hasn't. I've listened to David. We've become good friends. He does a fabulous job. If you don't listen to him on Monday night, you're really missing out. I learn something every Monday night from David in his conversations. But really, that's why I got involved in this, is it's safe for everybody. And so, anyway, I'm talking too much. You're supposed to be asking.
No, you know what? I mean, everyone's just loving everything that you're sharing, and I wish we had more than an hour because the time is just flying through here. And I think one of the things as well, just to back you up there, is because I mean, even for my son, right? He had huge eczema, and using the product for like 3 weeks, his eczema completely cleared up, right? So I can definitely second that. It's in my opinion, it's very safe for children. Now, I guess it's kind of like a funny timing, right? Because the same time you kind of came across Fountain of Life. So I guess in the most previous company that you're working with, can you share the COVID impact becomes COVID, but the COVID impact that company, which maybe perhaps also led you to Opulence as well?
Absolutely. COVID, had a lot of impact on many companies, but our company in particular, the company I was with in particular, because many of the ingredients that we were using and in the product that I had made for children, many of those ingredients came from other countries. So Japan was one of the countries that an essential ingredient came from. Germany was another company, one of the essential ingredients came from. And during COVID, Japan literally would not ship anything to any other country. And so for 9 months, at least, it might have been longer, but 9 months, I remember, we had no product literally for these autistic kids. We didn't have anything that there was no substitute for this product that was available. And still to this day, Japan has not opened up it's an amino acid, and Japan still has not opened up. So we would still be suffering from shortages of that product. And then also there was some mismanagement going on at that company with regard to distributing product across the world. We could get some products, but they just, warehouses would get shut down, or countries would get shut down. Things would just get locked down, and there was, I'm just gonna say this, if I can put it this way, there didn't seem to be an impetus on behalf of the management of that company to really work at how can we make sure that the people that are making their living from this company are going to be supplied with product. And it was just a dramatic failure all around. And so I literally was left without very many tools that I was so used to using for people. So yes, I had to find something, that I could rely on. And, that was one of the first things that really impressed me, is when I started talking to Ramin and to Sanaz, to Henry, to Dr. David that there was an abundance of product available. They had no trouble getting it to other countries during COVID. And I was like, oh my gosh, you know, this is just, the management of this company has really, I don't know how they did it, but they really stepped up for their people. I was just so impressed by that. And you know, that's your story to tell, not mine, because you lived through that. But absolutely, we were just left flat-footed, if I can use that term. People might know what that means, but we were just left dangling, kind of, as COVID went on. And
I think it's so important for so many of us. I guess because sometimes if you don't have that point of reference, like, you know, if you kind of went through Opulence and life was smooth, maybe not really seeing what's kind of happening outside world, you know, with other MLM companies. And I think it's great for someone like yourself that has such a vital, important, critical role in your company, because you weren't just building the team and doing presentations. You're also, you know, championing the whole advisory section, you know, the health aspect of it. And I think you're, as John always says, your weight in gold. You're definitely worth more than your weight in gold. And I think it's great to hear, you know, a different story of what has happened to not just like your previous company, but I know many other companies as well that just kind of fell fat on their faces during COVID. And just want to sort of, you know, show people that, hey, if you're in Opulence, life is good here, right? So
life is good here. People, you know, I don't really believe that they understand what it takes. What Ramin and the team back at Opulence did during COVID to make sure that people had product. Because I was living on the other end of that. Now, I want to mention something just about Phyto Clinical at the time, because I've worked with the company that's putting Phyto Clinical into the hands of the.
Actually, before you get there, let me just say, I think we should actually thank everyone. Let's give some thanks to Mr. Alan Ogden, because if you want to know how, unless I'm wrong, but the way that Phyto Clinical became knowledgeable to our company CEO was because of Mr. Alan Ogden. He actually was the one, I think I was in Taiwan, and you had messaged me saying that you have another product that you believe if we could get it into Opulence's suite of products, it would just take things to the moon, because you're just speaking so highly. And then you actually arranged a call, of course, with Jack Davidson. So guys, if you wanted to give one thank you to someone who actually brought Phyto Clinical, and I had to actually commend Alan on this, because he is positively relentless when he finds a good product, like Phyto Clinical, and when he found a great company like Opulence, in keeping that deal together. Let's put it that way, right? Because sometimes when we're going through different, I guess, negotiations, you know, different people have different expectations, and, you know, they come to the table, they walk away from the table, and you're just so good at always finding a way with your special words. Maybe it's your gift that you have to actually, in crafting emails, I don't know what it is, to put back, yeah, you know, Mr. Jack Davidson and of course our CEO back at the talking table, which eventually led to this. So yeah, I want to say thank you, Mr. Allen. I want to recognize you for you were the one, you know, who, just like how, you know, you were the one who brought Phyto Clinical to this company. Of course, you know, I mean, I want to say thanks, of course, to your good friend John Buswood, because he had a huge, vital role, of course, with, I feel like you and John together made the whole successful expansion and changes with Thailand and your previous company with the new products. So yeah, I just want to say thank you, Mr. Allen, for that.
You're welcome. I just want to explain, first of all, with Phyto Clinical, that was another product. Because of Mr. Davidson, that product was always available during COVID, and he never ran out of product. It was available. And so, you know, around the world, when I look at the science behind FOL and I look at the science behind Phyto Clinical, on the surface, they seem like they do the same thing. But physiologically, or from a medical point of view, they're not doing the same thing in our body. And it's kind of unfortunate that at the start it got called FOL Clinical or something like that. It gave people the impression that it had FOL in it. But I wanted to bring these two together because the synergy that people are going to see from the use of these two products together, once again, is going to be something that we can't even explain to people. They're just going to have to experience it. And I know that you've had a little experience with that. Sanaz has had a little experience with that. David has had an experience with that. And so when you take these, you will know that they're different products. And I don't want to put Phyto Clinical in the light of being a panacea, like it's like for everything. It's not. It's a very specific type of immune product. And so if I can just take a minute, maybe, if you don't
Oh,
mind.
take as much time as you want, because I'm sure everyone here wants to know, because as much as possible. So you keep going here, Alan. Thank you.
Sure. So FOL, the lignin product, lignins have a specific way in which they handle inflammation in the body. So inflammation is a natural thing that happens. We need inflammation in our body. If we break a bone, if we have a bruise, if we have a wound of some kind, the first response in our body is inflammation. If you cut your finger, it swells, it bleeds. That's all natural. That's something that back in the days when we started using reactive oxygen species or anti-inflammatories and antioxidant, that was something that they kind of forgot about, is the fact that you can't live without oxidation. We're oxygen consuming machines. So we can't just not have oxidation in our body. And it's a vital part of healing. So what you want to do is you want to encourage the aspects of inflammation that encourage healing. And there's certain proteins in our body that do that. So you want to encourage these proteins to be made in our body to reduce inflammation, while at the same time reducing some other proteins that prevent healing. So chronic illness is an imbalance between those proteins. If I can just put it really simply, don't want to get into big names and whatever, but when you have a chronic state of inflammation, you have an imbalance in these cytokine proteins in our body. And what FOL does, it actually encourages the proteins that reduce inflammation from their ongoing production in the body, and encourages those that are healing. So it stops the one or slows down the one. And that's why you get these dramatic effects. Your eczema goes away, this goes away, that goes away, your gout goes away. It's literally because it's shut off one type of protein and it's encouraged the manufacture of another type of protein. And we'll maybe in Toronto or something, we'll get more into what proteins do in your body. But I want to keep this as simple as we can today.
Thank you. Wow.
And so then once you have a restoration of this balance in protein, where your body is able to now put healing protein out instead of the damaging protein, that's kind of what FOL is doing. The lignins in FOL, that's kind of at a scientific level, at a basic level, what they're doing. But once you have that balance going, now you want to heal the damaged tissue. You want to specifically heal your immune function. It's been out of balance. These certain types of cytokines that actually cause chronic illness are very, very hard on your immune system. And so while we've balanced that using FOL, you still want to repair your immune system. You want to strengthen it and try to bring it up to a level that maybe it hasn't been before. And that's what Phyto Clinical does. So it has activity directly on immune functioning cells. So most people would think of our immune system just being the white blood cells. So, if somebody has cancer, their white blood cell count is way out of whack. That's one of the things we first look for is, wow, their white blood cell is just crazy numbers, oh, that means we've got to start looking deeper. And quite often it's a cancer of some kind. And so then we want to see if we can balance those out and bring other immune cells, strengthen other immune cells that have really complicated scientific names, eosinophils, phagocytes, et cetera, et cetera. So without getting into that too much. But what Phyto Clinical does is it looks at the weakest parts of your immune system. So let's just think about COVID for a second. And we have all these people who are suffering now from long COVID. They can't really get over their COVID. What has happened there is those particular immune cells that would help them recover from COVID have lost the ability to carry antibodies. So what our immune cells do actually is they carry a memory of literally every virus, literally every bacteria, literally everything we've been exposed to in our body that's carried in our immune system, stored in our liver. And should we be exposed like to a flu that we've had before, boom, right away, these immune cells will just carry these antibodies all over our body, go and attack that and get rid of it. We might not even know that we might feel a little feverish or a little off for a couple of hours, and all of a sudden, oh, well, that passed, or 24 hours, oh, it's gone. And that's because these particular immune cells in our bodies have been activated, and they take the antibodies and they run out over our body. Well, in long COVID, we've lost the ability to do that. And in other chronic immune systems, we've lost the ability, literally, we've lost some of the memory of these antibodies. So what Phyto Clinical does is actually restores and strengthens these immune cells and gives them a greater ability now to carry antibodies. So our body doesn't ever forget that we've been exposed to something. So when we were exposed to, if you remember back, we were given a measles shot way back when we were maybe 5, 6 years old. I don't even remember when my measles shot, the MMR, the mumps, measles, and rubella shot. I don't even remember when mine was. I've never worried about it since that time. And the reason I've never worried about it since that time is because we have this incredible immune system that will remember those things. But if it's weakened in some serious illness or chronic illness, it gets tired. It just gets tired out, if I can use that term. And what Phyto Clinical does is come back in and gives those immune cells the ability, once again, to carry these antibodies and our body to make the antibodies. So now you have Phyto Clinical. So I like to explain it like this. Right now we have this big, huge fire going on in Vancouver. There's a logging down by the Fraser River. There's a big logging company where they make wood chips, and last night it went on fire. We're getting smoke here in the city. And so when you have a fire, the first thing you want to do is put it out. So, they've got like 16 fire trucks down there just pumping water on this thing as much as they can. And that's really what Phyto Clinical, I like it to liken Phyto Clinical to something like that. You've got this urgent situation, you need immediate attention. It's like putting water on a fire. That's what FOL kind of does. It's immediate. There's an immediate balancing of these proteins, but it's like putting the fire out. And then once the fire is out, now you've got to rebuild. And that's what Phyto Clinical does. It comes in and it rebuilds what's been damaged and strengthens.
I love that analogy. I love that.
Right. And so here's I want to set the expectation for Phyto Clinical correctly. It takes 90 days for us to actually recycle all of the red blood cells in our body. So you can't take Phyto Clinical for 2 weeks and expect magic. Now, some people experience some really nice things in the first 2 or 3 weeks, but literally we remember that it takes 90 days for us to clean out all of those damaged red blood cells, to clean out a lot of these other lymphocytes, white blood cells, etc. That takes at least 90. Sometimes in people with chronic illness, it can take 180 days. It might even take a year. for all of this sort of to happen. So this is a product that it's been missing from our diet. You know, the plant sterols have been missing from our diet for a long time. So you have to take this product for some time. And that's not unusual. So from the drug industry, which I come from, and many people who've been put on particular drugs, they've been told, now listen, you're going to have to take this for a period of time before we know what it's going to do. And that's literally because we have to allow the body to have this 90-day adjustment period where our red blood cells go away. We get a balancing effect. So just to set the expectation, while we may get immediate effect like my friends did with gout from FOL because it put the fire out. Now, you know, I've encouraged John and the other people who had that to take the Phyto Clinical type product to make sure that the immune system is strengthened so their chances of having that again is minimized. So there's just such tremendous synergy between these two products. We're going to, I know that within a few weeks and months as we move ahead with Phyto Clinical and Fountain of Life together, there's going to be some dramatic changes in people's health and in their lives.
Wow, Alan, I can tell you right now that everyone on this call wants to get their hands on this new product, right, guys? if you want a free bottle, no, I'm just kidding, right? I think everyone is just enjoying the call, and I think I've learned so much about Phyto Clinical because we've had some talks about it. But like, I think because of your expertise and your knowledge background, we've learned so much more about this product. And if anything, I think everyone now really understands that, you know, again, FOL puts out the fire, but Phyto Clinical kind of rebuilds the structure inside, essentially. Yeah. And yeah, if you want your Phyto Clinical, say aye, right? I know I want mine right away as quickly as possible too. Wow. So. Again, you know, I'm just so impressed with you, Alan, because, you know, the first time that conversation happened, there wasn't any, I guess, agreement on that. Yet you kind of really came back to put that conversation back together again. So, like, what was it? Like, I'm kind of curious to know myself. You know, I mean, you could have just been happy, you know, with you know, your organization coming on board, but like, it must be something much more deeper for you to want to just put that thing together, right?
Well, absolutely. I don't think I had found a more compatible and synergistic product than Fountain of Life to work with Phyto Clinical. And after I met Ramin and Sanaz, which was a year ago, actually this weekend, they were out here in British Columbia, so it's a year ago this weekend that we got together. I introduced them to Jack. Actually, I think it was September 12th. Today's the 11th. And
wow, what an amazing time for this call, right? That's crazy.
It's crazy, right? Yeah, it is. And so we got together. We introduced Jack, and we sat down. You know, Jack is a very knowledgeable gentleman, but Jack is a true scientist. And of course, Jack didn't have the benefit of experience with lignans. And I just couldn't let this go. Really, honestly, I couldn't, you know, I know there was some, it was literally, I think from Sanaz and Ramin's point of view, they're not scientists, and they're excellent business people. And that's what I saw in them. I saw a couple who were innovative. They were wanting to bring the best products possible to the field, and they couldn't grasp the science in the period of time that we had together, but they did express interest, and I really was like a dog on a bone with this, because there is no two products that are more synergistic in what they do for immune function, and I just felt we've got this team that's got great. It's not great. Actually, for the people in Opulence Global, you have extraordinary management. You have extraordinary visionary management in the company. And you know, I know other people from other companies have come to Opulence and they can probably say the same thing. Is the visionary behind Opulence Global, the team that's surrounded Ramin, Sanaz. You're not going to find a combination of people like that. I mean, I'm amazed at some, when we were doing this negotiation, I would be getting emails at, 11 o'clock my time, which means it's 2 o'clock down in Ontario. And I'd be getting an email from Sanaz or I'd get a comment from Ramin or something. I'm like, my goodness, I've never been in a company where the executive team is so committed and so on top of what's going on and wants to really be at the forefront, wants to change this industry. And I didn't want to lose that and this product. It was just, they had to come together. So it did take us a little while, but I'm glad that I was able to build that bridge and see this happen.
Alan, I know that for this leadership cocktail, I know that I had asked you and wanted you to have done this leadership cocktail like long time ago. And again, just for those who are wondering, why is it about a year now? It's because again, Mr. Alan Ogden was sort of locked in on contracts, I believe it was. So, yes. From a safety legal point of view, he had to sort of just, respect his contracts. But now that I believe is done for a while now, that's why, we actually could have scheduled Alan in earlier, but we had other people lined up first. But again, that's why I'm just so blessed that we have this call today. I've been waiting to do this call with you for like a year now, pretty much, to pick your brains. And so I guess, we could sort of move on a little bit now if you want to. There's more you want to share, but now I'm kind of thinking about, so the science part's amazing, and I just can't wait to have you, yourself, and Jack together, in Toronto, because the things that you guys can share together on stage, that's why if you haven't bought your ticket for the Product Innovation Conference, do you see today was like a little snippet of what you're going to be missing out on if you don't attend that event. And I do have a few early bird tickets left if you want to send me a message afterwards. Get my number from somewhere on WhatsApp or Facebook, but get your ticket. But again, moving on to the MLM side, right?
Sure.
Because you're an LD too, so you're not someone who's just sort of putting the deals together and kind of stepping away. You're actually, and I still recall, I mean, how hardworking you were in your first few weeks of bringing in people, and you're making great income as well too. So what was it, I guess, that like if I want to pick your brains on, what did you see on the MLM side, not just the science side? Yeah.
So I'm going to just drop back in my history here briefly. So when I was having to make a career-changing decision, in 1988, I made a presentation to the Alberta Pharmaceutical Association. I was actually the media director for the Alberta Pharmaceutical Association, which meant that I met with the TV, radio, whoever, on issues regarding pharmacy. And back in those days, people had to be a pharmacist to own a drugstore in the province of Alberta and many other provinces. And I had been following what was going on with that industry. So I'd made a presentation to them that said, basically, no one really knows why your pharmacist charges a professional fee or what they do as a professional. Now, pharmacists are the #1 trusted profession, and they're the most accessible healthcare profession. Pharmacies are open 24 hours, open till midnight. There's always a pharmacist around that you can go ask a question to. But I said, other than being a retailer, people really don't understand what it is pharmacists do. And if we don't get that message out, we're going to be like California, where you're going to get big box stores and our profession is going to be devastated. And a Real Canadian Superstore opened in Edmonton in 1989. And that was the beginning of the end sort of for independent pharmacy. I saw that coming. So I didn't know what I was going to do next. Honestly, I'd been approached by many, many people in network marketing, and I had really no interest, honestly, in network marketing. I didn't understand it. I had no appeal. But The way the gentleman approached me, and I think this is since we're on a leadership cocktail, this might be important for people to understand. How do you get a person who has 3 drugstores, has a vast experience in the retail industry, interested in this? And so one of my friends owned a clothing store. He came into my store one day and he said, Alan, if there's anything in life that you'd want, what would it be? And I said to him, well, it'd be more time. I was working 120 hours a week. And he said, oh, well, I think I found a way. And he left. I thought, well, that's strange. That's weird. And
That's funny.
About 2 weeks later, he's back in my store. And so I said to him, hey, Les, what were you talking about the other night? And he looked at me like this sort of shocked look on his face. And he said, oh, you'd be interested? I said, yeah. Oh, well, give me a call sometime. And he left. Whatever, I'm busy. I don't really have time to sort this through in my brain, what he's talking about. So November 4th of that year, he came into my store and I said to him, Les, are you going to tell me what you're doing? And he literally did this. He looked at his watch and he said, it's November 4th. Your store is full of stuff that's going to be no good to you after December 24th. You don't have time to think about anything else. If you're still interested, call me after Christmas. And he was right. I did have, Christmas is a very big time in the retail industry. So he was right. And then in February of the following year, Donna, my wife, and I had an argument. It was teachers' convention. Now, for people, Donna, my wife, was one of the individuals who actually created inventory management, computer inventory management programming for the retail industry.
Wow.
So yeah, she's a very amazing lady. And she worked on developing that whole inventory management program, which is still used in retail to this day. We didn't know anything about patenting it or licensing it back in the time. We just wanted it for our own stores. And so she was busy with the programmers and the inventory management. I was busy running these businesses, and we had teachers' convention. And so we had this big argument about our kids, who's going to look after our kids. And, I never got in business to hurt my children. I always felt I was doing what I was doing to help my family. So I came home that night and I said to Donna, I'm going to sell the stores. And she almost passed out. I mean, literally, she kind of grabbed the counter. She's like, what? I said, I'm just going to go work for somebody else because this is not working for us. I need to find something where I can leverage my time. I can leverage my experience. I can leverage, I've got to spend time with these kids are going to grow up and be gone. And, what are we going to do? And so I phoned my friend in February 11th. And I said to him, hey, you have time for lunch? And so we met for lunch, and he explained this idea of time leverage. I'd never heard of it, time leverage. But first we sat down in this restaurant and he said, Alan, I got to tell you, I'm really surprised to be here with you. I said, really? He's like, yeah, I'm kind of intimidated by you. He said, first of all, you live in the nicest house in town, which we did. You have, your idea of delayed gratification for something is, however long it takes to get a new vehicle from, Ontario to Alberta for you to drive, which is true. We had a corporate account with Chrysler. My vehicles, we literally just took them back to a dealer, turned them in, got a new vehicle. So we never dealt with a dealership really at all. We dealt with Chrysler Canada on our cars. And I did by all, he said, there's 100 people in this town that would change places with you. And I said, wow, they'd be dumb if they did. And he said, well, why don't you just buy another store or open another drugstore? And I laughed. Well, that's another 50 staff. I don't have any more hours in my day. And so he said, can we agree on something then? If you knew how to leverage your time, you're a smart man, you would have already done it. I said, yeah, I guess so. And he said, okay, so can we agree that there's something that you don't know that you need to know? And I was like, I liked him enough to say yes. And he said, all right, so you're going to have to learn something. If you're going to get involved in business with me, you're going to have to commit to learning how this business works. not assuming that you know how it works, because you don't know how it works. But I can introduce you to a man who is in your situation, who is actually the mayor of his town. He owned a large real estate company, and he now works, minimal hours a week and makes 4 times as much money. And I said, I'd like to meet that man. So I did. And I sat down with this gentleman. He was very, very square with me about the fact that, MLM has a certain reputation. You're going to have to live with that. In our country, maybe not in other countries. And he said, but I don't want you to do anything until you do this. And he put me on a 90-day training program. He wouldn't let me talk to anybody. He said, I want you to learn the essence, the basics of the business. No one put you in a drugstore without your education. So don't get in this business without an education. And so one of the things that I strongly encourage everybody who gets in this business to do, listen to the Monday night, listen to the network, forensic networker, get yourself educated on what this business actually is so that you can approach people like me and get their interest on time leverage, money leverage, how this whole thing can impact their life. And so that's what I did. And then I started going out and contacting people completely like I'd never heard anything that I, been trained on. And so I went like 0 for 200 on my first contacts. Nobody was interested. I was so excited and enthused about what I'd learned. I just, I wanted them to know right away. I didn't give them the same opportunity that my sponsor had given me to make a good decision and make this decision for them to get involved in the business. And so what I'd like people to understand from that is you have to give people time to get this into their, what this change can mean. Now, some people are ready right away. They're ready for a business and they get into it. But I think most of the most powerful leaders in network marketing are people that have had a career or profession. They wanted to change. There was something about their life that they wanted to change, and they're looking for that answer. And your job as somebody who's prospecting is to find out what they want and then offer them the solution. And it's not because FOL is a great product. FOL is a great product, and maybe that's what they need. But for somebody to get involved and really pay attention to the business and build the business, it has to be this understanding of what it's going to mean for their life. So I had that experience. I was mentored. Renee, I want to thank you. You've been a tremendous mentor in getting involved in this business. To me, answering questions, being available. The relationship is just been beautiful. And I'm sure you're that way with everyone. You're a tremendous leader in this industry. And that's what it takes. It takes patience. It takes understanding. You're changing people's lives in a dramatic way. And they're going to have to go through that process. So I was able to go through that process. I got involved. We built a very, very large business. There was thousands of people in our business. We were number 3 in North America 3 years in a row in that business for personal volume, for group volume, personal group volume. And so that part of that was my experience as a pharmacist and having knowledge. But part of that was just the fact that we taught these values to everybody. Everybody that would get into our business, we would plug them into a system. And that's what I love about Opulence. There's a system. You can go in your back office. You can find the meetings that are all over the world. You can plug somebody in wherever they're going to hear the same thing. They're not going to hear anything different. If they're listening to Rico, if they're listening to Venetia, whoever they're listening to, they're going to get the same message. And I love that. I love the fact that I can plug people in around the world. It's the value of a system cannot be underestimated or even overestimated. And so if you look at what we had in retail, I had two competitors in my town. We didn't get together and discuss business strategy. We were competitors. So you're on your own. And in this business, really, there isn't any competition. I mean, if there's somebody next door to me that's involved in Opulence Global, I want to see them do good. Why? Because a rising tide raises all ships. If I can point to somebody in my community that's already done it, that's a tremendous advantage to me. If you live in Ottawa and you have somebody in Toronto that's really successful like Renee, and you can point to that person, even if he's not your upline, you can go there's the fruit of this, there's the result of doing what's necessary in this business. So really, when you understand the power of network marketing and the power of the team, the whole team, like, I don't know if I have never met her, but I'm going to meet her. She's Daniela. These are powerful women that can lift your team and lift women in your team. So this is so unique in the whole business community, to have the power of everyone towards the same goal and to lift you up, and to have a training system that's there for you. So that's what got me into the industry. Then once I understood the industry, it was like, why would I ever want to own a retail store again? When you have somebody that will pick, pack, ship, handle inventory, deal with suppliers, and all that kind of thing, it actually kind of chokes me up a little bit. All the services that they supply, and do it with humility and grace, and just keep on doing it. So, our job really is to become experts in presenting this business in a way that we're never going to get everybody in the business. That's not my point. But there are people that are looking, and there are people that are desperately looking for a change. And you might look at somebody and they live in a nice house, they drive a nice car, but you don't know what's going on in their life. You'd never know who's going to get involved in this business. But your next leader, it could be an Alan Ogden, it could be somebody that so my point is, you got to get to know those people. You got to get to know something about them. Be patient, be diligent, learn how to approach people, and you can build a huge business. And the people that have got in business with me, they're quality people. They're just really great people. And that's what we want. We want to build this powerful team. Anyway, that's kind of my background and how I got involved. And then every time I get involved, people find out that I have this scientific background. I have this medical science background, and they want me to contribute. And so and it's okay. In a sense, I appreciate that I can still make that contribution and help people understand what they have their hands on, so they can do a better job of presenting this business.
Well, and I mean, the team here truly appreciates you, and I think I can say for all of us that we're so blessed to have you as well as part of the Opulence community, the Opulence family, because like John says, you're definitely worth your weight in gold. And I think what's even more powerful again is just hearing someone like you who loves MLM, and yet again your background is so vast. I think a lot of people might still have that mindset of someone who has all these pharmacies, they'll never do MLM. Yet you're just a shining example of someone who, like you're saying, like why would you want to have a retail store? And I don't think people who have never had a retail store or own a retail store understand all of the logistic nightmares behind that. You might make good money, but again, like you're saying, like, what's your cost to it, right? So, I can't believe that we've gone past an hour like that. I think it's been 10 minutes here. It's been like an hour already. And again, I know that a lot of people that would love to get to meet you in person, folks. I do believe that Alan has made his plans to get to be in Toronto as well too. He had some personal things to deal with. I do hope again to see you in Toronto as well, Alan. I know that your presence would be greatly welcomed, and that everyone would love to shake hands, get your autograph, take photos, and pick your brains more so. But was there any final words you want to share with us before we let you get back to your day here?
Oh, final words. No, I really do want to edify you and the team at Opulence Global. That would be my final words. I don't think anybody could be better positioned than to be in this company and be involved and So thank you again, Renee, for your patience with me. And thank you to all the team. I haven't met them, but I know there's a great team in the Opulence Global Office that are taking care of us behind the scenes. We don't even understand and appreciate like we should. But
Actually,
thank you
I
all
always
again.
forget. I met you first and then John, or John first. I think it was you first, right?
Me first, yes.
And you actually introduced me to John Buswood afterwards, right? Yes,
Yes.
yeah. So again, I was really the one who, my kids and I, we watched the new Pinocchio movie last night, but he's the one holding up all the strings, doing all the strings and the dancing around. And of course, John, if you want to come online and share a few words here, you just raise your hands. I know that you're probably busy, with your family as well too, but I know that you're also on the call as well too. But yeah, so again, it's just been great to have you here. And again, there's just so many comments coming in from everyone on the call, just saying thank you, thank you, thank you, thank you, thank you. And I think again, like for myself, I learned so much even about Phyto Clinical today, just on this short, 1 hour session with you as well too. And I know that I see a very, very prosperous and long future together with you here in Opulence. And again, we're just so blessed to have you guys here. And yeah, so I could just give a few quick moments here for anyone who might want to share any few last comments, or of course wanted to raise your hands and maybe share a few words. John, are you there, John? I'm not sure if he's there or not, but we'll just wait for John to see if he's available there or not. But yeah, you have your whole Thailand team, which is here with you as well too, and they're again saying love and hearts as well too. So yes, actually, people just saying thank you.
I'm here right now. If you can you hear
oh,
me?
hey there, John. Again, thanks for being on the call.
Sorry about that, guys. I just a few minutes ago, Alan and Renee, my wife went into her bathroom, and we've got water coming through our ceiling. So,
oh no.
So for the last 5 minutes, I've been on wait for the emergency number for our building to let people know that we got water coming through the ceiling from the suite above us.
Ooh, that's never good.
Yeah. But I mean, I gotta say though, I'll just say this quickly because I just handed the phone to my wife to handle with the property people. But I just want to say, Alan, you're a true blessing. You're a true friend. You're a brother, and I just have the highest respect for you. You're just an amazing man. Donna is an amazing woman, and the two of you together, like 1 + 1 = 10. You guys, thank you for everything you've done for bringing all of this information to us and for educating us all of the time. You're an inspiration. And, Renee, you are always there for all of us. And I don't know how you do it because, you've got so many thousands of people pulling at your coattails all the time. And you always seem to have time for us. And, just absolutely can't wait to see what happens in our future here because, as Alan and I, after our initial meeting with Donna was there as well, Sherry was there as well. And when we had the initial meeting with Sanaz and Ramin in Vancouver, we walked out of the hotel that day after they spent many hours with us. And we all looked at each other and we said, I just think we found our forever home. And we've never looked back since that time. And I just can't wait to see what the future holds for us in the coming months, coming years, because this is our forever home. So thank you, Alan. You're a true blessing. And I hope we can all get together in Toronto in less than 2 weeks and have an amazing time out there as well. Just a continuation of the adventure.
Thank you, John. Yes, looking forward to it. Thank you, Renee. And I guess we've got to say goodbye at some point.
Yeah, it does feel like, and just final words here, that it just feels like we're getting started. It's a funny feeling. I've been here for 14 years, and I might be like a dinosaur in this company, but for some reason, it always feels like we're just getting started. There's so much to do, so many lives to change. Again, so yeah, thank you everyone for being on the call today. Again, special thanks to our leadership cocktail presenter this morning, Alan Ogden. Thank you, John Buswood, again, and thank you to our Opulence family for tuning us with us this Sunday morning. You could have been doing something else. I don't know, at the beach, at the barbecue, but you're here with us learning. And I hope you see why you need to get yourself to the Product Innovation Conference. Make sure you buy your tickets. I still have a few early bird tickets left, so please reach out. And again, one last time, on behalf of the entire Opulence family, Mr. Alan Ogden, thank you so much for your time today. You are just a huge help this morning. And this recording will be available. I think this is one of the recordings where you want to send to those people who, you think wouldn't be interested in MLM. This is a recording to send to them. So that being said, have a wonderful morning, afternoon, evening. Stay blessed. For one team, one dream, to the billion. And thank you, everyone. Bye, everyone. Have a good night, morning, and evening. Bye, everyone. Thank you.